nodule was located at the fovea or in between the superior arcade and fovea. It was grayish-white in color, dome-shaped or bilobed, with subretinal exudation in all the cases. There was surface pigmentation. The second or third order retinal vessels entered the nodule and continued till apex. 1/3 cases had calcification. The periphery showed the telangiectatic vessels, exudation and subretinal fluid. OCT showed this entity as a well-defined hyperreflective subretinal nodule involving the outer retina, RP and Bruch's membrane. There was disorganization of the inner retinal layers. Ellipsoid zone and ELM was disrupted. There was posterior shadowing surrounding exudates, but no fluid. Dense localized hyperreflective areas of RPE aggregates were also noted. On ultrasound B scan, it was an eco-dense mass with highly reflective A scan spike on surface. There was calcification in 1/3. On fundus fluorescein angiography at the macula, it showed early hypo with leakage, focal leakage, and late hyperfluorescence, increasing in density because of extensive leakage and staining. In the periphery, it showed the typical light bulb aneurysms with CNP areas. The primary treatment given was laser photocoagulation of the leaking vessels and also scleral buckling with external drainage of SRF and observation in one case. And at a mean follow-up of 8 months, the best corrected visual acuity was maintained in all cases with no significant gain. Thus, to summarize, the macular nodule in coats presents with xanthochoria in an older age group of patients in males, usually unilateral, vis-a-vis retinoblastoma, which presents as leukochoria in a younger group of children, can affect both genders, unilateral or bilateral in presentation. Here, the AC and vitreous is clear, but in retinoblastoma, it can have seeds or blood. This is a grayish-white nodule with surface pigmentation and surrounding exudation, whereas retinoblastoma appears as a fluffy white macular nodule with feeder vessels and calcification. And the giveaway is the peripheral telangiectasia, which we need to look for. On OCT, this is a subretinal nodule, whereas retinoblastoma is a full thickness retinal mass. On FFA, we need to focus on the periphery where the light bulb aneurysm and CNP areas will be seen in coats. On ultrasound B scan, here it can either be dome or bilobed with calcification in only 1/3, whereas in retinoblastoma, it is usually dome-shaped and calcification present in 90 to 95% of cases. Thus, to conclude, this is the first Indian study on Coats disease with macular nodule. It represents a vascular process and has an extremely low incidence in Indians at presentation. This is the first study to describe layer by layer the OCT characteristics of macular nodule in Coats. The poor visual prognosis is due to the extensive degenerative change in retina as evident on OCT. So it is of utmost importance to be aware of the typical fundus appearance and adjunctive imaging features of this entity to differentiate it from retinoblastoma. Thank you everyone for patient listening.
Thank you so much.